Okay, I think we are all set. So welcome everyone to the first session of our Recruitment Boot Camp Mental Health Staff Edition. I'm Alex Rowling, and I'll be kind of leading things throughout these sessions, but I'm also here with Michelle, which I'm sure pretty much all of you know if you've been to any of our trainings, and she is going to be co-piloting with me through this. And so, yeah, welcome everyone. Glad you could all make it. First, before we get started, I'll just real quick go over kind of the things that we probably all already know, having worked with Zoom way too much throughout the pandemic. But this session is going to be recorded, and that recording is usually available within a day or two. So I know that some people had questions about how many team members can join in and everything. So the link that the registrants get, each of your links is an individualized link, but your login to the discussion boards where you can view the recordings and everything, that you can share if you're comfortable sharing that login information with other people on your team. So if there's other folks that want to join in and they can't sit in the room with you during the trainings, then they can always view these recordings afterwards, and you can always go back and reference them. The PowerPoints will also be made available, so any links to resources or to the assignments that we'll do throughout the Learning Collaborative, those will also be available, and you can click the link on the slide in the presentation slides, or you can look on the discussion boards and we'll post links to everything. And you can also use those boards to communicate with your cohort as we go through this. And then as we're all here, we want to make this as good in a learning environment as possible. So just be as present as possible. I know that everyone's got different kind of feelings around camera and everything, so don't feel compelled to, but if you're okay having your camera on, it's great for everyone to see kind of that feedback, and we get to kind of know each other because we also live all over the place, so we don't always get to see each other face to face. And then if you have any technical issues, please send Mariah a chat, or if it's a really bad technical issue and your chat's not working, you can email her at mblake@clinicians.org. But you should be able to just send her a chat if there's any technical difficulties. And then obviously you can email me, Michelle, or Mariah with any questions that you have. All right. And we're here on behalf of ACU, which is the Association of Clinicians for the Underserved. It's an organization that was started by National Health Service Corps alumni over 25 years ago now. And so the mission has kind of changed a little bit over those years, but it's continued to focus on improving the health of America's underserved by supporting the clinicians serving in those areas. And recruitment and retention of kind of all aspects of the healthcare teams is a really important part of that. And so ACU also operates the STAR Center, which is the Solutions Training and Assistance for Recruitment and Retention Center. And that is a program funded by a national cooperative agreement by the Bureau of Primary Health Care. And so we're one of 21 NTAPs, or National Training and Technical Assistance Partners. And we focus on workforce very specifically for health centers and PCAs. And so any of the trainings that we provide are free, and we have tons of resources that we very specifically make to try to help with recruitment and retention of your workforces. And here's the STAR Center staff. Lots of people that are all very excited to help you out. Do feel free to reach out to any of us or to our general info@chcworkforce.org email if you have any questions. We are available to help individually. We can provide training and technical assistance, and we also have lots of resources. And we're more than happy to answer any questions. And then sessions 2 and 3 of this recruitment boot camp, we are going to have Dr. Adija Oganyemi, and she will be here as a subject matter expert. She is fantastic. She is a practicing therapist in a health center, as well as an adjunct professor, and she just has tons of insight on the workforce side, the recruitment and retention side. specifically for mental health staff. So I'm really excited that she's going to be with us for a couple of sessions this round. But for today, you're just stuck with me and Dr. Michelle, and we are going to go over for this session some of the basics of mental health care providers, so we can kind of understand all of the different types of providers that are out there, everyone working in that mental health space, and how it kind of fits in with the rest of the clinical practice. All right, but first, we're going to do a Mentimeter. For anyone that's not familiar with it, Mentimeter is a little like online polling program. You can pull out your smartphone if you have it and do the QR code thing, and it'll take you right there. Otherwise, let me put the link in the chat here. You can go to, oh, someone's already on top of it. Perfect. Thank you, Michelle.
Yeah.
You can go to menti.com and put in the code there, and it will take you right to the chat. And I am going to switch sharing here and pull up the Mentimeter screen.
And I'm putting the direct link as well that can be used in the chat.
Okay. My Mentimeter screen disappeared. Let's see here. Oh, there we go. Okay. All right. Can everyone see that okay? All right, we got people joining in. I'll give you just a couple more minutes. I like all the little icons that it gives. I didn't realize it was going to do that. This is the first time I've done it's kind of in quiz format for the first couple questions. So usually we just do the poll format, so this would be fun. All right. So question should pop up on your screen. Okay, so you got 30 seconds to answer the riddle. What can you hold in your right hand, but not your left? All right, time's up. Let's see. Oh, someone said a right glove. That's interesting. So the correct answer is your left hand. Oh, right elbow is a good one. But if you can hold your right elbow in your right hand, you have some extreme flexibility skills. That's or you've been in a bad accident. Yeah, your left fist, that one should count, sorry. But yeah, so your left hand is that clever one. I'm not very good with pens and pencils, so I think that one works well because I'm right-handed. But all right, excellent. We got one more of these because they're fun. Oh yeah, and we have a leaderboard. Looks like Santa Claus is the little figure assigned there, and the train. So Nicholas and Katie are both, and Mary are right there. All right. Question 2. All right. What do Alexander the Great and Winnie the Pooh have in common? All right, 2 seconds. All right, let's see. They both like honey. Interesting. So their middle name, their middle name is the joke. So Winnie the Pooh and Alexander the Great. But I assume, like a lot of you, that they both like honey and don't wear pants. I like that image of just both of them walking with honey jars, no pants on, and conquering. I don't know when Winnie the Pooh conquered, but I'm sure it was something. All right. Thank you for bearing with me through a bunch of silliness. Congratulations to everyone. I think everyone had great answers. But anyway, let's focus a little bit on the training on the recruitment boot camp and kind of what do people hope to gain from participating in these next 4 sessions. Because this is also something we do. Oh, thank you for the good icebreaker. I appreciate it. We'll try to come up with some more good icebreaker ideas for the one of the later sessions. Okay, so help recruiting and retaining mental health professionals when compensation isn't necessarily an available option. Oh yes, and thank you. Anyone who's having trouble can put this into the chat as well. We had Tracy saying looking at ways to recruit differently. Yeah, so just different approaches. How to look for, so like kind of how to recognize and find qualified mental health providers and where you can best put out those job advertisements. Excellent. Proper licensing, creative ways to recruit and retain. Recruitment for providers to serve in person, because that's a big challenge, because there is a lot of remote work going on and a lot of people who switch to totally remote and don't want to come back, right? Creative ways to recruit top talent. Long-term employees in rural areas, because that's another challenge too, is avoiding just the people cycling through. Looking for ways to meet patient needs while still struggling with staff, and that's really hard. There is kind of a balance point where if you don't have enough staff, you just can't provide care for everyone. All right. So what do you feel is your greatest struggle in retaining these? And we got a little bit of that on the last one, where sometimes it's location, sometimes it might be pay, sometimes it might be options like working fully remotely versus when you need people to come in and actually treat patients in person.
Yeah, and like one of the individuals wrote the licensing, and I know that can be a struggle when you're looking for people who are clinically licensed, especially social workers, since there's a lot of different licensing that they can get.
Yeah, absolutely. Okay, so finding therapists to work full-time. And Tracy even offered a little suggestion to her own issue that they might be trying, so maybe offer job sharing opportunities and kind of some schedule flexibility, probably allowing people to trade shifts or kind of arrange for non-standard work days. Okay, compensation and location. Yeah, being in a rural area, location. So yeah, location is definitely going to be a big challenge. And recruiting, yeah, so not enough therapists in the area. So how do you draw people in from outside, especially to those rural communities? And then compensation and primarily on-site work. Okay, yeah, so, and the correct licensure to see Medicaid patients, because if you have payers that won't cover the type of health professional that you have, that can be a huge challenge.
And when we get to the part, when we go through the roles and we talk about social workers, I'm happy to give a little bit more in depth with the complexities of the licensing. So I'm a social worker, so I can provide some of that information.
Okay. Well, thank you everyone for sharing. That insight really does help us, because we will try to tailor some of the things that we talk about to really fit people's needs. And so let me switch things back up here. Okay, can everyone see the correct thing? It should be a little Mentimeter slide. Perfect. Oops. There we go. All right. So as we go through the recruitment boot camp, some of our goals are definitely going to be to learn from the materials that are presented and the expert faculty, but especially each other, right? That's one of the big points of this. We're going to try to do breakout sessions, especially this first session and really the end session. But then also, just if you have something to contribute, we're going to have some good Q&A sections when we have Dr. O for the next 2 sessions, because you know, she is a practicing therapist at a health center and really has some good insights on this. And so come prepared with questions, and she's going to have time and be available to really answer those, to try to get you some really individualized stuff. And be sure to, you know, to talk to your colleagues, to share information, especially we have the discussion boards. And I know sometimes people are really active on them and sometimes they're not, but if you have suggestions, something that's worked for you or your health center, then sharing that, because other people might be in need of that information. And so, yeah, sharing challenges and strengths. And then hopefully we'll all leave with some new ideas and knowledge, and we can make little tweaks. And it might be something big that we can do, or it might be, oh, these are some little changes. I'm going to change the wording in my job announcements. I'm going to change where I post those job announcements. I'm going to offer new opportunities to our mental health staff. You know, those will all kind of come together, and they might just be little tweaks that help you build a bigger strategy. But hopefully that's what we're going to be able to come up with by the end of this. All right. And so some of the tools, obviously, we're going to use the live sessions. We're going to have some breakout rooms and time for discussion. And again, like Michelle said, she is also a licensed social worker. And so she can answer questions in that realm as well. So you have a couple really good resources as we go through this. So do think about using those. And if you put questions on the discussion board, we try to monitor those. So if you think of something, you know, in between sessions and you want to put a question up there, we'll try to get you an answer for that. All right, learning objectives. So we're going to go over the types of mental health providers. We're going to try to understand specific needs for each one. And then we're also going to look at the role of onboarding. So as a practice of really bringing people in and having them kind of expand that workplace culture, as opposed to just learning the ropes, the basic process of orientation. We're going to look at that as an expansion thing, and then also look at how it's really important to tie together the behavioral health practice with the physical health clinical practice, and then the larger community as a whole. And then we're going to look at how to tailor job announcements, interviews, compensation packages, and career development to both retain mental health staff that we have and help them build up and continue to improve, but then also attract in people because they know it's a place where they can continue to develop. So hopefully we're going to all have a really good personalized recruitment plan by the end of this, and you'll be able to start implementing that plan at your health center to help improve recruiting and retention. So now we're going to do a quick, how about a 10-minute breakout? And when you go into the breakout rooms, excuse me, I'll go in and post in the chat all of these points, but basically just discuss your job and role, you know, just a little bit about where you're coming from in the recruitment retention sphere, and, you know, maybe share something fun about yourself if you want, or how you liked the weird riddles that we did as an icebreaker. And then, you know, you can talk again about goals and everything and share those with people. They might have some feedback, and then, you know, share with people anything you found helpful so far. Or you can talk about shared challenges, because it seems like you all are coming from a lot of similar places, have some similar hurdles that you're working to get over. So we will split you up there. Okay, hopefully you all got a chance to kind of meet your colleagues a little bit and share a little bit. And then at the end, we'll have a little bit of time for Q&A if anyone has questions on the presentation, especially for Michelle with her subject matter knowledge. Then also, if we have time, feel free to share anything that came up during the discussions. All right, so we're going to talk about the types of providers and kind of go over some of the basics of, yes, sorry, these sessions should be an hour long, and I'll try not to hold anyone over. So over the next 25 minutes or so, we are going to discuss types of providers, some of the basics of their licensing, mainly so that everyone has an idea of, all the different provider types and what their different kind of scope and licensing requirements are and what their training requirements are. And where that's really going to play in is if you're doing HPET work, so health professions education and training, like, okay, how can I interface with educational institutions, understand what their learners are going to need, and then potentially have them interact with our health center to some level, because that really helps with recruitment, getting people coming right out of school. They get to know what a health center is, again, especially in the mental health field. You have a really good patient population that they'll be very motivated to come serve. So that's kind of where some of this understanding comes in, but then also in retention, like how might people be looking to progress in their training and in their licensure and certification levels. So when we look at where all of that fits in, we obviously have the mental health department, but then remember that the patient going in is often going to interact with the more kind of physical clinical fields, right, and vision health and dental. And then they're also going to be interacting with the community. And so we want to make sure that we're considering that and helping our staff to have connections between all of these, right? Because I'm going to feel a little bit helpless if I am a, say a primary care physician, and I don't have a clear understanding of how can I connect this patient to mental health care that they need. Or am I a mental health provider and I'm not sure how I can easily connect someone to some community services that they might need, or to the correct physical care provider. And then reaching out to the communities and letting them know, hey, we have mental health providers that see patients. If you offer services that might benefit these people, or want to better understand people who are living with mental health challenges, like how can we provide services that will benefit them? There's lots of potential options for interaction, and that's really important. And not just for providing better patient care, but also for these providers to feel empowered in what they're doing. And they know, oh, if this problem's something I can't help, maybe there's someone else who can help with that. And that can really improve satisfaction and therefore job satisfaction, right? You feel like you're actually providing adequate care to people, and that's really critical. And so if we look at mental health departments within them, we have enabling services, right, which are just kind of generalized support services, and then cover a whole range of activities. And then you have the much more directed assessment and psychotherapy side, which is of course going to be kind of what we all picture when we think of mental health, is talking to, a psychiatrist or a mental health counselor or another type of therapist. And then we also have the medication management side, right, where people who have mental health issues that require some sort of medication support, then they're going to be able to go and get that support. And that's going to always be coupled with therapy, right? They're never going to be independent. So within enabling services, we have a whole range, again, of support. And just within the health center, we might have peer support specialists, social workers, community health workers, or promotores. And those are all going to be people coming from different backgrounds of training and educational resources. Social workers in general at the base level are going to have a bachelor's degree, and they're going to be able to provide case management services. So more on that kind of administrative side. Usually you can't get licensed to practice clinically as a social worker without a more advanced degree.
You actually have to have a master's. You cannot do it as a bachelor's. Yeah.
Okay. Thank you. Yeah, Michelle, again, knows a lot more of the nuance with this than I do as far as the licensing requirements and everything. Oh, sorry.
I was just going to say one other thing with social workers. So they have to have a master's to eventually get the clinical license. It's different. Some say independent clinical, some have clinical. MSWs, though, can also do these enabling services. And one great way to get these individuals, because it takes a long time to become clinical and a lot of money. Most social workers pay someone like $100 a week or more to get that supervision. So you could have an MSW in the enabling services and then offer them the opportunity to get supervision in your health center. So once they become clinical, they're offering those therapy services as sort of a way to pay that back.
Yeah, absolutely. And so, kind of understanding, especially with social workers, there are a lot of tiers that they can progress through as far as education and licensure. And so when we start thinking about that, it's like, okay, how can if I bring someone in really early on in that journey, how can I kind of allow them development opportunities? Because that's going to be really attractive, right? It's almost, you could think of it as like, could I recruit like a medical assistant and allow them to move up through nurse and then nurse practitioner and then doctor? And like, that would be a really weird clinical progression to go through. But for a social worker, like that's a much more linear progression. And so it is actually fairly realistic to support them through that progression. And at the end, you could end up with someone who, has a doctoral degree even, but is licensed to work clinically and provide these healthcare services, who came in, just out of or even during their undergraduate work in college, right? And it's also a very attainable goal to look at people like community health workers, who usually there's some sort of, certification process that they go through. But then some of these people may want to stay in that realm, or peer support specialists, right? Again, people with lived experience who are helping others, having that same experience, navigate the systems and everything. These people may want to develop their education and careers, and these can be really good pathways if we understand them for career development, for staff development. And so as we move on, we also look at medication management, and this is where kind of the most restriction as far as licensure is going to be, right? Like whenever medications become involved, it generally requires kind of the highest level of clinical licensure. So you're going to have clinical psychologists.
And Alex, you may be seeing a different slide. We're seeing the assessment and psychotherapy one. Yeah, not the medication.
Oh, I'm sorry. Okay, good. I looked at the wrong slide on my Q thing. Thank you. This flow makes a lot more sense now. I was like, oh no. But yeah, so so I'll go back just so we're all on the same page. So we have the enabling services personnel, who are kind of usually what someone's going to see when they first come in the door looking for mental health services, right? And then we're going to go on and we're going to look at the assessment and psychotherapy side. And this will include psychologists, clinical social workers, right? So social workers who have that master's level or higher and have achieved licensure, counselors, psychiatric nurse practitioners, and psychiatrists. So anyone who's going to be providing therapy and counseling. And then as you go higher up, people who can make specific diagnoses if that's within their scope of practice. And you'll even start to see people who can prescribe medication, right? So like psychiatrists, nurse practitioners, and let's see, Michelle, can clinical psychologists or clinical social workers ever provide medication?
Psychologists, in some states, there are some exceptions. Clinical social workers cannot. Counselors as well cannot. So that's an important distinction when you're bringing someone in, for example, looking at what compensation you're going to give them, ensuring that people who are doing the same job are receiving equal compensation. Those who can do more, obviously, it would be different. One of the other things that I want to mention, because I know we saw this a lot in the applications we got, there is right now, unfortunately, kind of a limitation on clinical social workers. Part of the issue is the licensing board who runs the exams for clinical social workers chose not to do the exams virtual during the pandemic. So many social workers who were ready to move to that space were held up over a year from receiving their licenses. So it backed up the workforce, essentially. But with all of these, what's also really important is it is also very state dependent. So the licensure, the type of license, the name of the license. It's really important to look at your state. So I'm in DC, and they have a licensed master's level social worker who cannot do clinical. You have a licensed clinical social worker and a licensed clinical independent social worker. So each of your states will provide just, different types of licensing depending on the profession.
And Michelle, correct me if I'm wrong, but it's generally scope of practice that those different licensure terms covers,
Yes.
and
Yes.
how whether you have to work underneath someone with a higher license.
Yes, exactly, absolutely. And how much supervision you need. For example, with psychologists, they're always going to have a doctorate. Most social workers will have a master's, the same with counselors. Psychiatric nurse practitioners depends on the program they go into, and psychiatrists, same, being an MD or a DO.
So, when you're recruiting, one, obviously you need to recruit the proper licensure for the position that's open, but also understanding where is their flexibility, right? Do I have someone of that, higher level licensure already who can supervise, provide clinical supervision for people? It's just like with doctors and PAs, right? I can have a bunch of PAs that all work under one physician. But obviously, if I have no physician, I can't recruit a PA to do more than what their scope of practice says they can do on their own. And just like with that, the licensure is going to vary a little bit state to state. But in general, you're going to have a fair number of people that need to practice underneath someone of a higher licensure level.
And one of those, Alex, if it's okay, I'm just going to say
Oh, yeah.
one last thing. So the training for all of these are not really interchangeable. Everybody gets specific trainings in the specific models that work with what they're studying. At the end of the day, they can all do therapy. But one of the things, and we'll talk about this later in the Learning Collaborative through the other sessions, it's really important when you advertise for this, when you're interviewing people, that you make sure you let them know the type of modality that you are working with in your health center, and that they tell you what they were trained in. So a lot of social workers are trained in very different modalities. Like mine was cognitive behavioral therapy. I don't practice clinical now, but there's some other social workers that were never trained in that. Well, I would say some that is not their focus. So having that conversation is incredibly fundamental when you're looking for a therapist, to make sure that there is that connection, the same with the type of populations they're trained to work with.
Mm-hmm. Yeah, so like Michelle was saying, there's different specialties, and there are a lot of social workers that specifically focus on schools, right? And so there's a whole field of social work around education. But remember, when you're recruiting, if you have the ability to recruit people who are looking to achieve licensure, or at one of those early tiers of licensure, they might be looking to either change their focus or gain new levels of licensure and everything. So there is still a pathway, and looking at these internal pathways, because even something like a nurse practitioner, right? You have to have your RN first. And so you may have an RN on staff who's really interested in behavioral health. And if there's a way to help facilitate them going and getting that master's degree and getting the nurse practitioner licensure, then you might be able to kind of home grow your own nurse practitioner. So while this is all very complex with all the web of different certifications and the ways you can get there, as you can develop an understanding of that and talking to staff already in those positions about how they got there and about what the different types of licensure means, when we really understand that, we can start to see different paths to the same route. And that opens up how many different places we can draw from to get not just recruiting outside staff, but potentially developing up staff who already work for us. And sometimes that's a slower process, right? It could take 6 months to recruit a psychiatric nurse practitioner. It would take a couple of years to home grow one. But if you find someone on staff who's really interested in it and you can support those career aspirations, they may stick around longer in the end. So that can sometimes be one of those ways to help deal with those issues, like, oh, we're in a really rural area, we have people come through for a few years and then they leave, right? So kind of thinking and starting to understand, like, how do all these different routes to get to different types of licensure fit in? And yeah, if anyone has specific questions about that, Michelle is a great resource. Again, doctorate in social work, so she knows those processes. So certainly email her or ask a question on the discussion board. All right, and then we obviously have the medication management. And as I said before, this is going to be restricted to, a lot of the highest levels of licensure. And that doesn't necessarily mean like, it's generally a subset within those, right? Like Michelle is a doctor of social work, but because of different restrictions on licensure, for all kinds of various reasons, medication management is usually very highly restricted. But it has expanded beyond the role of just MDs. So it's not just psychiatrists anymore. And you may end up with primary care physicians who know a fair amount about mental health medication, depending on the population they're working with. And so again, whenever you recruit someone new, even if it's for a little bit different role, you may talk to them like, how much experience do you have working with mental health populations, and kind of looking at what are they allowed to prescribe in your state? Like, are they able to prescribe certain psychiatric medications and everything? So again, understanding that whole scope of license can be a little daunting, but can be really important. So psychiatric nurse practitioners, it depends on what they're doing for, and I think it varies by state.
It does. It varies by state. So some states, they practice completely independently, both in therapy and medication management. And I'm sorry if I'm mispronouncing your name, please let me know. I'm not sure what state you're located in, but there is a movement more and more to practice independently simply because there just aren't enough psychiatrists. And they can also practice though under, like, if you have a chief medical officer, it doesn't have to be a psychiatrist. It's just any physician that you have available.
Yeah, so one of those interesting things that I think some of it is just a holdover from the old days when a doctor was a doctor was a doctor. There were no differentiations, but yeah. So when nurse practitioners, again, there's kind of this recognition that those, for lack of a better term, second tier, like NPs and PAs, practitioners need more and more independence because there's just not enough doctors and it's not really practical or necessary. And so, yeah, in California, that could be kind of tricky, but sometimes states have, kind of surprising scopes of practice for some of these other practitioners. And someone asked Michigan what the requirements are for this.
Actually, Adisha's in Detroit. So she will, Dr. Ogunyemi, sorry, I did my doctorate with her, that's why I'm like Adisha. Dr. Ogunyemi, she is in Michigan, so she can definitely tell you that, but I can reach out to her and look it up. I also did my doctorate in California, so I can ask the people that are still there the question about California. Right, Mary, exactly. Some of them practice under, and you're in Michigan, so perfect. Yep, so they'll be practicing under the license of the physician.
Yeah.
Yeah, in DC, they can practice completely independently. So that's why it depends.
Yeah. And often, like, if someone practices, if like an NP is practicing independently, there may still be restrictions on kind of the scope of medications they can prescribe, but if they're allowed independent practice, they're probably going to have like most of the ones that you would need for kind of standard mental health care. Excellent. All right, so we were talking about all that, and I kind of alluded a lot to this HPET, the Health Professions Education and Training, and just to touch on it again real quick, it's looking at building a pathway. We used to use the term pipeline, but some indigenous groups find pipeline to be kind of a traumatizing term for very obvious reasons. And I think Pathway describes this a lot better, right? It's not, people aren't just funneled and they have no choice. We've all seen it. We try to provide someone a pathway and they choose their own path, and that's okay. But we're opening up routes for people to go into the positions where we need staff. And so, again, this can be working with people inside your organization already. You may have a community health worker who wants to go on and get their bachelor's in social work and transfer into that, or they may want to go on and be a nurse or anything like that. But then you can also partner with educational institutions. And educational institutions, you have more power in this realm than you often realize. They almost always are looking for, you know, good partners for getting students in to do their field training, that clinical training where they do under the supervision of a practitioner. And like Michelle said, this could be working towards licensure for social workers, which is can be pretty challenging because you have to have time with patients, again, under that supervision of a licensed practitioner, just like nurses have to do. But with social workers, it's not always just during school they get it all taken care of and they come out licensed. They can have to put in a lot of work afterwards. So it may be you hire someone earlier on in that process, help them attain that experience, and then 6 months or whatever later, you end up with a licensed social worker.
And the social workers throughout all of your master's program, you have to be in a field placement. So that's another great way to build these partnerships, because think about not just schools that are near you, but all of the online programs that there are across the states where they need to have these field placements.
Mm-hmm. And so, yeah, this, you know, the approach is going to vary based on the staff that you're trying to recruit and whether you're trying to pull them in from outside or develop staff from within. And we have, Mary said that they host students doing their clinical rotations for medical and mental health nurse practitioners. It's really hard to find clinics that have psychiatric and mental health nurse practitioners already there to train students because they're in big demand. So that's the other thing, is if you can have one provider that can see students and you can manage to arrange it so that they actually have the time to do it, right? We don't want to just shove this on top of someone, be like, do another 20 hours a week dealing with students. But if you can provide them the time and space, it can be a really good recruitment tool, and you can build that really strong partnership with an educational institution and really let people know about the health center as an option for employment. All right. So again, just kind of drilling into that with enabling service staff, we're going to want to look at, you know, certification programs. And again, a lot of this is going to vary by state. And I hate not being able to provide just like, okay, this is exactly what's required and it works for everyone. So some of it is looking into what your state requirements are and whether your health center maybe can fulfill them on their own. You might have a training program, that grow your own program for peer support specialists or for community health workers, you know, just like some places do for medical assistants. But it might be that you have to work with a state certifying body to get them tested and certified. It's going to depend. Let's see, and we had a question, but okay, I think Michelle was going to look up and see, but it was just how much experience do people who are supervising clinical students coming through have to have? And that usually depends on I know that for, say, like nurses and everything, the person has to be licensed and they have to be approved by the training institution, but they don't, you know, it's not, you have to have 5,000 hours treating patients in most cases. It can be sort of newer staff, but you do want to give the students a good experience, right? You don't want to take some brand new person, and even if you can legally, shove a bunch of students at them, right? You want them to be pretty confident in their clinical practice. Excellent. And then as far as the therapy and diagnostic side and the medication management, you know, obviously those programs, those training programs can require a lot more input. So certainly you have teaching health centers that have graduate medical education programs running, and they're going to have psychiatrists rotating through if they host a residency. But you can also work with a residency that already exists. Some hospitals that run residency programs might be willing to rotate some of their residents through, and you get that little extra bit of help in exchange for having a doctor there who can supervise some of those residents. Or again, for psychologists, you might be able to have a clinical psychologist on staff, provide some of that field experience, some of that clinical experience for psychologists who are getting their PhD and want to do the clinical side, or have graduated and want to move into clinical. A lot of times you can cooperate with people who already have these kinds of programs set up. So working with that hospital that normally is like a competitor for recruiting, we might be able to say, hey, if you want some of your residents to get a little bit different experience than just working in the hospital, why don't you rotate them through our health center? And we can get a variety of specialties coming through. There's lots of good opportunities for that. And then again, with social workers and counselors, they usually need field experience, or sorry, clinical, I keep saying field, but clinical experience. It's my bad habit from, I was a paramedic, and so we always called it field experience because it sounds more exciting, like we're in the savannah or something.
Social workers call it that, field supervision.
Field supervision, yeah. So just looking at the programs that are out there, and here's some references. I don't have to go through them all now, but they're all linked. And so you can kind of look at the different requirements for licensure and training through these organizations. That might help give you a feel for some of the different requirements for training these different groups. And then I know we are about out of time, so I'm just going to go through real quick. ACU also has our comprehensive workforce plan, and we've updated it with some more sections, some more information on building HPET programs, those health professions, education and training partnerships. And you just want to make sure that you're keeping track of where your success is coming from, so we can keep doing that and always look for new opportunities and make sure that it continues to align with your goals. And then, mission, compensation, benefits, work schedule, that's all part of this retention planning, which is again part of our comprehensive workforce plan. And we also go through recruitment planning, right? So we want to make sure that we're bringing in the right staff. And we're going to go through all of this a little bit more over the next few sessions. But then here are the links to that comprehensive workforce plan template. And the links are live, so you can click on them there, and that will take you right to those. We have a template that you can fill out, as well as instructions that kind of explains everything. All right, so before the next session, which is in 2 weeks, we have a little self-assessment that we like people to take. And so the link is there. We're going to post it in the discussion boards as well, but you can always download the slides and use that link. It's just an assessment to kind of understand where you are as far as workforce and help you kind of pick out some spots to really focus on. And then this just talks about the discussion boards, but again, you should have all received an email directing you to log on to there. If you have any issues, please email Mariah or me or Michelle. We'll get you taken care of. Our next meeting in 2 weeks, we're going to be with Dr. Oganyemi, and she is going to have some fantastic information for all of you. So please, if you have any specific questions, come prepared with those. She is a fantastic resource. Okay. Does anyone have any specific questions about today? And I know we're wrapping up on time, so I think Mariah is going to put up a link to an initial assessment. This is very short, but it's just going to be that that knowledge change that we need to track. And we want to make sure that we're providing the right things to you with these recruitment boot camps. So if you have time, please fill that out. And we'll have a little bit of an evaluation at the end. And then I put some of those resources up earlier, the recruitment retention, the comprehensive workforce planning. But we have lots of resources, and we really do encourage you to go through and explore. There's times you can get nice and lost in there for hours or even days. If you need help finding your way out of our resources page, just let us know, because there's a ton of stuff in there, and it is all really good. And we also have a podcast series. That's fun. Then you can listen, so you can multitask, and then an hour later you're like, why am I so exhausted? And it's because you're doing 3 things at once. That's what I do, at least. But the podcasts are really good, and we do a lot of ones on self-care, and those are really excellent. And our contact information in case you have any questions for us. Again, please do that self-assessment, and do check out the discussion boards. I'll put the link up there for the self-assessment, and we look forward to seeing all of you in a couple weeks.
So how can we click on these links?
Oh, when you download the slides.
Download the slides. Okay.
Yeah.
Sorry.
And they will be on the discussion board.
Okay, awesome. I was thinking.
No, thank you. Excellent question. I was just saying, click on the link, and yeah, not even thinking about that. Yeah. Once you download the slides, they'll be in a PDF, and you'll be able to click on all.
I was clicking, and you guys are going from full screen to little screen, full screen.
Oh.
I was like, what am I doing
No,
wrong?
very good question. Excellent. And I'm happy to hang out for a few more minutes. I don't want anyone to feel like they have to stick around, since we are now a couple minutes over, but happy to answer any questions that people have.